Hi everyone, welcome back to my YouTube channel. I'm here with Dr. NicolePlenty, board certified OB-GYN and high risk specialist. Also, she's the creator of the Pregnancy Pearls podcast.
Thanks so much, Janay, for having me. I really appreciate being here.
Awesome. Tell us about yourself and tell us about how you came to Pregnancy Pearls.
So I'm from a really small town called DeRidder, Louisiana, which is sort of on the Texas-Louisiana border. And once I left this small, like 10,000 people population city, I went to Xavier University of Louisiana, and I thought initially I was going to be an attorney because that's what my scholarship was for. And then I had a cousin that passed away from complications of pregnancy. She had an eclamptic seizure, and then she ended up having pneumonia, and she ended up passing away. She was 23 years old. She was 29 weeks pregnant. The baby survived, but she didn't. So that is sort of what made me want to do OB-GYN and take care of people that are high risk. And as you know, Janay, a lot of Black and brown people have a much higher risk of passing away in pregnancy in general because of health complications than our majority counterparts. So that is what made me definitely do high risk OB-GYN. After I moved to Indianapolis after my training, I became the division director for maternal fetal medicine there in Indianapolis, and I got pregnant. I almost died. And I had a lot of complications, right? I had blood clots in my leg. I had 3 blood clots, or what's called pulmonary emboli, in my lung. I had neurocardiogenic syncope, which basically means your pulse rate's above 130 and you can just faint, and no one really knows why. I had hyperemesis, which is nausea and vomiting in pregnancy. And then I ended up having a C-section because my son was breech, meaning he was butt down instead of head down. I lost 3,500 cc's of blood. I had a mass transfusion protocol. So after that made me want to come a little closer to home, which is how I ended up moving to Houston. And once I moved here, a lot of my patients still reached out to me. They still had a lot of questions. They felt like they couldn't talk to their own OB-GYNs because they were too busy or running out. And most of my patients have my personal cell phone number anyway. So I felt a need to create some type of database. So when people contact me or send me emails, I can just shoot them something back really quickly. So initially I started the website, which is just pregnancypearls.com. And then that became a YouTube channel because people were asking sort of the same questions over and over again. And I said, let's put this on video. So then that way they can just follow the YouTube channel. A friend of mine during the pandemic, we reconnected. She is the co-host of another podcast I have called Oh, That's Deep, Black Women Conversations. She is basically a media guru. She's over promotions for Radio One. And she was like, you know what, you should really create a podcast with all this content. So that led me to create Pregnancy Pearls with Dr. Plenty, the podcast, which comes out every week, wherever you listen to podcasts.
Wow, that's awesome. And I'm sure that must have been scary for you to go through all those complications and everything.
It is definitely scary to be the patient and know exactly what's going on. So my husband was pretty ignorant, right? He was like, oh, I knew they weren't going to let anything happen. And, you know, these are my friends taking care of me. And they were like, oh, no, we were scared. We were really scared. So, yeah, it is nerve wracking. But, you know, everybody has to go through something. And no one's exempt. It doesn't matter if you're a doctor or not. You can still have complications.
Wow. And because of your Pregnancy Pearls podcast, I tried to do something with my jewelry. I don't know if you can see it, but I have some
Oh, you have pearls! I love it.
Can't really see my necklace, but
oh, I love it.
Thank you. I try. No, I don't think my pearls are as fancy, but
they look fancy.
Thank you so much. Well, I really wanted to have this discussion with you because as a graduate student in mental health counseling, a lot of people don't talk about the issue with PMS and PMDD. Mm-hmm. And I don't see a lot of information out there as well, or people talking about it. So I have some questions in regards to that. And what is the difference between PMS and PMDD, and how common is it?
So it's common. PMS, 30 to 40% of women have PMS, which is just premenstrual syndrome. So that's just symptoms that evolve around your ovulatory cycle. So those symptoms usually happen about a week before you get your cycle and can abate a couple of days after your cycle starts. So some people may have irritability, bloating, they can have cramping, they can have increased fatigue, right? So if you have premenstrual dysphoric disorder, which is PMDD, that is a way more severe form of PMS. And so that is far less common than PMS. So PMS, 30 to 40% of women have PMS symptoms versus only about 10% having some form of PMDD. And when we say some form, most people, to get that diagnosis at some point in your cycle, you have to have debilitating symptoms. If you have normal day-to-day functioning, then you don't necessarily have PMDD. You have more so PMS symptoms. But some OB-GYNs will diagnose PMDD if someone has extreme fatigue, just to make sure that if they're exhausted and they can't function, they can't operate a vehicle, that still changes your day-to-day life. So you may not have debilitating cramping or mood swings, but if you have fatigue that severe, that would be a milder form of PMDD. So basically, it's all on the spectrum, but PMDD is obviously more severe and affects portions of your life versus symptoms that you can cope with.
Wow. Okay. And what are the signs that we can be aware of, and when is it necessary to get help?
Sure. So there's a lot of symptoms of PMS. Okay. So irritability, some people have weight loss, cravings, cramping, bloating, restlessness, or an increased fatigue. Some people have jitteriness, and then most people have bloating. So the bloating, cramping, fatigue are the three sort of triads of PMS. The others are other symptoms that can present. PMDD, you're going to have at least 5 of those 11 symptoms that are extremely severe. So severe mood swings, anxiety, depression, crying, decreased alertness, increased fatigue, severe cramping. When you get to the point where you're not functioning, or you're like, you know what? I'm real moody and my husband doesn't like me, maybe I should ask somebody. That's when you should seek help. I always tell people it's better to ask if you need help than to just assume you don't need help. And then all of a sudden you are in the bed, you're severely depressed or debilitated, and you're not getting the help that you need. So I would say when you feel like it's affecting your day-to-day or your family is influenced by it, you should seek help.
That's really important. I feel like, especially in the African American community, I feel like sometimes we can just brush off things. Like I know my mama might be like, "Girl, that's normal. What you talking about, girl? That's normal." But it's like sometimes it gets to a point, with these individuals going through this. Sometimes it gets to a point where it really pushes them to have to see someone. And I was doing some research and I found some scary statistics. And one of them was those with PMDD, 15% will attempt suicide.
Yeah. I mean, you can get extremely depressed with PMDD. Like, it's a real thing. So I think that you're right. A lot of people don't talk about it because it's almost like offensive, right? I don't know if you grew up like this, but I remember, like, if I were the least bit cranky, like somebody would be like, "Oh, you're PMSing," and you're like, "What did what did you say to me? I can't believe that you said that." But really, you have to check yourself and be like, "Okay, wait, do I really have premenstrual syndrome? Like, maybe I am extremely irritable." And if you feel like, man, I feel down all the time, I feel hopeless. If you have a family member that feels like that, I mean, you should encourage them to get help, because you're right. You can have people that attempt suicide and can be successful at it. And PMS is very, very common. So up to 40% of women have it. PMDD, not as common, but even if it's not as common, if you have a chunk of those, 15%, that may attempt suicide, well, that's a serious thing. And the reason you probably can't find a lot of data on it is because it's sort of kind of taboo, right? Just like I got offended when I was younger and somebody was like, you're PMSing, like people get offended. It's like, you can't say that to a woman. Like, what did you say to me? So as a result, there's not a lot done on it. People don't want to admit that they have these symptoms that are affected because of the hormone changes that they're going through, with their menstrual cycles.
Definitely, more people need to talk about it and reach out to someone, and if it's a close family member, just to talk with them, and then also their OB-GYN. So just to make sure, because there is help available, and we'll get to that in a moment. How should women go about tracking their symptoms if they do feel like they're struggling from PMS or PMDD?
Sure. So I usually encourage people to keep an ovulation calendar anyway, because I'm in the business of pregnancy. So for me, you need to know exactly when you're ovulating and when your menstrual cycle comes on. But it's really also important, even if you're not trying to get pregnant, to know what your symptoms are. So track the timing of your symptoms. If you're like, I'm down all month, I feel like I can't get any sleep, I feel irritable, I'm very depressed majority of the month, well, maybe you have depression and you don't have PMDD. But if you're like, man, every week before my cycle, every month before my cycle comes on, I start to get these feelings. So I would encourage people to track their symptoms, use a tracking calendar, and literally put how you feel each day. And then we look at a trend. So if we know this is coming a week, 7 to 8 days before your cycle starts, and it's ending in the middle of your cycle, well, those are either PMS symptoms, or if they're severe, PMDD.
That's really, really significant for us women to know what's going on with our bodies, but
Mm-hmm.
also to track it, because a lot of the times we're just like, oh well, I'm not sure, or maybe it happens during this time, and I think, like you said, actually putting pen to paper, or if you have an app of some sort, so that you have clear, okay, this is when it starts, this is when it stops, this is how I feel at this time. So, and I'm sure there's apps out there that help with that. My next question is, are those struggling with PMS or PMDD more likely to struggle with other mental health conditions such as anxiety disorders and mood disorders? Do those overlap?
Yeah, they can overlap. So just because you've already been diagnosed with an anxiety disorder, or because you've been diagnosed with general depression, doesn't mean that all of a sudden your symptoms can't get more severe during those times, which means that you also have PMDD. And then we also know that people that have anxiety and depression, just in general, can have an increased risk of PMDD. And those people have an increased risk of mood disorders in general. So yes, some of it does overlap. We know that people that have PMDD, even if they don't have a diagnosis, other than PMDD, also have an increased risk of postpartum depression and psychosis. So yes, psychiatric disorders do overlap, and PMDD is considered one of them. Unfortunately, we don't know the cause of PMDD to say, hey, there's a direct genetic linkage between these two things. But research does say, yes, they do overlap.
Wow. So there's nothing that can really pinpoint. That's kind of like that with most things in mental health. There's
Yeah.
no pinpoint
Yeah.
cause. It's, could be environmental, could be biological, a myriad of things. You kind of just answered my next question, which is, those that struggle with PMS or PMDD, are they more likely to struggle with postpartum depression?
Yes. Yes,
Okay.
they're more likely to struggle with postpartum depression and anxiety. And those are people that usually get checked on during the pregnancy, right? Because pregnancy is caused by, causes a lot of hormonal imbalances. PMDD, those symptoms are worsened because of the hormonal changes that you go through at the time of your ovulation. So yes, naturally, some people can get depression that's diagnosed during the pregnancy as well as postpartum.
Wow, that is something. Wow.
It is. But you know what? It's like anything else, right? So I always tell people that have some type of mental health issue, whether that's depression or schizophrenia, like it's a disease you have to say, hey, I have this, and you treat it, right? So you don't go around not treating your diabetes when you have high blood sugar. Same thing with mental health. If you know you have it, you treat it.
Yeah, sorry, my stepdad. I don't
You're
know if
fine.
you hear my
Hey,
dog.
stepdad.
My dog is barking. My stepdad is imitating my dog. Um, this is why I gotta get my own studio.
You need your own studio.
Yes, I need my own. He's still roofing. um, Okay, great. Thank you so much, Dr. Plenty, because I feel like so many women can feel like they don't know where to turn to, or they don't know why they're feeling that way, or like around that time of the month, they get really angry, whether it's at like their husband or their co-workers. They get like full of rage and they're like, where is this coming from? And it's only around that time of the month. And like the scarier part that we talked about, which is women, getting suicidal and attempting suicide. What are the treatment options? What is the help available?
So, two treatment approaches. One is antidepressants or psychosocial therapy. And then the second is the ovulation treatment. So, usually, if we know that you're having these symptoms that are surrounding changes in ovulation, then we're going to put you on some type of birth control pill to sort of suppress ovulation or regulate your ovulatory cycle more. And so, usually, regulating those hormones more, that by itself can treat PMDD or PMS. Now, sometimes we need a little bit extra help. So there's some studies that show that people with PMDD do have lower levels of what's called serotonin. Serotonin is the happy hormone. Okay, that's what makes you feel happy. So we can give what's called SSRIs, which are selective serotonin reuptake inhibitors, which are antidepressants to treat your mood disorder. So birth control pills combined with mood stabilizers would be the treatment of choice if you have PMDD. If you have PMS, counseling, psychosocial therapy, which would be the first step. I think it's always good to have a counselor. Honestly, even if you don't have PMS or PMDD, I think everybody needs a counselor. I think everyone needs therapy. We all go through a lot, but especially if you have PMS, counseling will definitely help, and it would be recommended as first line, and then birth control pills would be second line. Rarely we would need to start an antidepressant, but sometimes we have to help stabilize the mood.
So as far as like the birth control, they normally recommend some. I think it's called progesterone. Normally progesterone hormonal birth controls because that's supposed to help with the fluctuations.
Yes, so we either recommend either progesterone only birth control pills, so like Provera, or a low dose combined hormone. So almost like a orthotricycline low would be an example of that. Some of your higher hormones, we wouldn't recommend those pills right off bat. But everybody's different. So some people need a triphasic pill versus most people need a monophasic pill, meaning it's going to release the same amount every single day to sort of stabilize the hormones. But if we start to see that, hey, this is not working and you need a higher hormone level around that time just when you're ovulating, then you would need to switch to either a biphasic or triphasic pill. And your OB-GYN can help you decide which one.
What about the one that goes in your arm? Is that one normally recommended?
So usually, I mean, the next one on is what you're talking about. That's a little rod that releases norethindrome daily. It doesn't really release much progesterone. Some people do have improvement with some of our longer acting reversible contraceptives. But when we're talking about treatment for PMDD, that would not be first line because we can't really regulate that, right? So once it goes in your arm, it's there. It's there for 3 years. Same thing with like an IUD. I mean, it works more locally than systemically. So it would be something that we're putting you on more of a pill versus the Implanon or the Nexplanon in your arm.
Gotcha. That makes sense. So then you don't have to go through the removal process.
Yeah, we're like, okay, wait a minute, you need more hormones, or no, this is too much, So we usually start with a pill.
Awesome. Thank you so much, Dr. Plenty, for answering. I believe that's all of my questions. So there is help available, and women, we don't have to suffer in silence. You're not crazy because you're going through these hormonal fluctuations, which is a lot of what society wants to put on us women, like, oh, you're going through this, or you're acting crazy, or what's going on, or they can feel like, I don't know what's going on with me. And
Right.
I feel out of control because the next minute they're having mood swings, or they're having this bloating or fatigue, and they feel like they just can't get themselves together, or they're crying over something that is so small, and they're like, why am I crying
Yeah.
right now over
Or
that?
they end up getting divorced and then remarrying their husband when they're postmenopausal because their symptoms have completely gone. That happens a lot.
Oh, wow. Well, for the fellows, they gotta hang in
Hang
there.
on, hang on.
On. Yep, hang on and be there to, support. Put on a nice movie or something, some nice snacks. Some, especially then around that time she craving certain things. Go get them peanut M&Ms. Go get
Yeah.
some pretzels or something. Um,
And
but
also for the dads or for the husbands, support is definitely what's needed, but sometimes they're like, I'm doing everything I can and nothing is working. Well, just realize it's not you. I mean, it's a hormonal imbalance. Instead of being accusatory or insulting, make sure you're being more supportive and literally approaching it in such a, hey, have you talked to somebody about that? I'm concerned about you, as opposed to, I hate how you're acting, being reactionary, because it is a real thing. And women that have PMDD can't control how they are, reacting to the hormonal changes that they have.
thank you so much, Dr. Plenty, for that insight. Where can we follow Pregnancy Pearls?
So you can follow me on Instagram at pregnancy_pearls. I'll also have a YouTube channel, which is just youtube.com/pregnancy pearls with Dr. Plenty, as well as on my website, which is just www.pregnancypearls.com.
Awesome. Well, we have plenty of information with Dr. Plenty, with Pregnancy Pearls. She is a board certified OB-GYN and creator of Pregnancy Pearls podcast. So go check that out and subscribe to her YouTube channel. Until the next time, thank you, Dr. Nicole Plenty, for coming on my show. I'm so excited
Thank
to have you.
you, Janay. Thank you so much for having me. This has been fun.
And it's very informative, and I hope that the people that come across this will reach out and ask for help if needed.
Please do. Please do.
All right, well, thank you all so much for watching my YouTube channel. Until the next time, we'll see you in the next video. Bye.
Bye.